Hello, everyone. Welcome to HR.com's HR Tech Symposium. This event was created to provide HR leaders the resources they need to succeed. We have just introduced new resources and professional development options for you and your teams with our new Prime membership packages. Please visit the HR.com booth in the exhibit hall or contact membership@hr.com to learn more. Thank you for joining us for this webcast, How Employers Can Break Down Stigmas Around Employee Mental Health, sponsored by Nivati. The webcast has been pre-approved for an HRCI credit. Please be sure to attend the complete webcast in order to receive your credit. You will receive an email from hr.com within 2 business days, which will include the certification credit information. You may also log into your hr.com account and view your credits you have received. If you have any questions during the webcast, click on the Q&A box in your webinar controls and type them in. And now it's my pleasure to turn it over to our presenters.
Hi, I am Amelia Wilcox. I'm the founder and CEO here at Nivati. And with me today, I have the awesome Haeli Harris. She is a licensed marriage and family therapist, a meditation practitioner, and a yoga instructor. And she's the lead clinician here at Nivati over all of our mental health services. So to go ahead and get started, I'd love it if you could just post in the chat where you are coming from for our session today. I'd love to just know if you want to throw up your city and state into the chat and just let us know. I love just knowing where everybody is. So Haeli and I are located in Salt Lake City, Utah. And we've got Oregon, Florida, Minneapolis, New Jersey. So a lot on the East Coast. Ireland, that's awesome. I'm so excited. I don't remember seeing an international attendee in any of my other ones I've done. And then we've got Georgia. Cool. So yeah, just throw it up there. Anytime you have a question, throw that into the Q&A. If you can't figure out where that is, you can put it in the chat and we'll try to keep an eye on it. But we'll be doing all the questions at the end, the last 15 minutes. So if you have any specific questions about your own team or any challenges you're experiencing, we're happy to answer those. So go ahead and put those in the Q&A. Before we get started, we're going to go ahead and put our first poll up here just to kind of get a temperature gauge on everyone here in the webinar. So we're going to pull that up right now. And we just want to know how stressed your workforce is right now. So just, do you have a finger on the pulse of your organization and where would you rank their stress level today? So I'll give you guys just a second to fill that in. In the meantime, looks like we've got Manila, Philippines here. We've got Ontario, Canada, South Carolina, Kentucky. And then it's early in Oregon. I got one person in Oregon. So awesome. Okay. Looks like those are still coming in. Okay, so basically it looks like we're in the moderate to very stressed. We've got 4 people saying their team's extremely stressed. So I think that's going to vary a lot by industry and just kind of the space that you guys are in. So just a little bit about Nivati and what we do here to get started. So we have an online employee mental health and well-being platform. We provide mental health services and well-being support for employees in 28 countries across the globe. And I'm just really excited to be here to talk about mental health specifically, the crisis we're experiencing, how that's impacting the workplace, and then what you guys can do about it. So there are quite a few solutions we're going to go through today, and I'm excited to get started. So I'm going to get started with a story. This is my dear friend, Shannon. Shannon gave me permission to share her story with you all today. So she is a retired Olympic skier. She has won multiple Olympic gold medals. She skied all over the world. She's a mother of 2 young kids. She is a ski instructor up at Deer Valley here in Utah. She's also an entrepreneur and does a ton of public speaking. I was actually just in an event with her on Thursday, and she was speaking at the Women Tech Awards, and she gets to travel all over the world speaking to people. It's super fun, high energy person. She really thrives on the energy that these live in-person events provide, and just loves like walking across the stage and then helping organizations improve improve their teams. So we've known each other for about 5 years now. We work together, we play together, our kids are friends, and we've seen each other through a lot of, hard times and good times. So she and I were sitting in a Zoom a few weeks ago, and we connect with us and a couple other entrepreneur moms. And we chat about the things that are going on in our lives, what's going well, what is really challenging. And we're all extroverted. So social isolation has been really hard for us, obviously, over the past year and a half. But we're also working moms and have kids, going in and out of school, depending on when the schools are open, when they're closed, and just dealing with all of that. So my friend Shannon, who has this awesome corporate team building company that she runs right now that is run by Olympians, she just broke down into tears, and she described this pain of loss that she was personally experiencing because her entrepreneurial dream had just come to a total halt, right? There just aren't in-person events, team building events, things like that. Everything's kind of turned virtual for the most part. So it just seemed like her dream had just kind of been killed by COVID. Because of that, she had financial pressure that she was under to try and pay for this life that she was struggling to pay for. And because of those challenges, then now her marriage is under a lot of strain, right? It's causing the financial strain of things is causing problems in her marriage. So she's not only physically isolated, she's also emotionally isolated and felt really alone in her pain. And she said that the stress was so bad for her that she had to actually get a mouth guard because she was chewing on her tongue in her sleep. And then she sent me this picture of her, and she's laughing at herself because she has to wear gloves to keep herself from picking the skin off her fingers as a stress response, because it's just gotten so bad. So she didn't even realize it was happening. She just realized she was just picking away at her fingers and started wearing gloves. So, and she's like the healthiest, most active, most inspiring, optimistic, happy person that I know. And so I think what I'm trying to illustrate by sharing this story is that it can happen to any of us. It's not necessarily people who have struggled with anxiety or depression in the past. It's not people who have any signs or symptoms of mental illness or any history of mental disorders. Even if you're exercising, you're eating right, you're meditating, you can still be negatively affected by everything we've been going through. So she wanted me to share that story with you all today because there should be no shame in what she's experiencing. This is a common human response to just this unprecedented amount of stress that we're all experiencing right now in our world. In fact, her story is not unique. 41% of adults are reporting diagnosable mental health conditions right now, which means about half of us in this Zoom room are in need of professional help to get through the things we're struggling with right now. And it's not a wonder why. So if you look at what has changed, these are all new stressors. Right? We've got fear of COVID-19. You could even add in here conflict in the workplace around COVID-19, mandates from work, mandates from the government. There's just like all these new things. It's not just COVID. Now the vaccinations have caused all these levels of stress. But this is the APA did this study and found out what was really causing stress for people. But remote work, I know that's stressing a lot of our HR people out as they're trying to figure out hybrid or return to work or remote work situations, social unrest, economic uncertainty, and political polarization. So these are all just in the last 18 months, right? And then what was existing before, that's not even counting these stressors that already existed. So this was like pre-COVID, they asked people what was causing stress and anxiety. And these already existed. So we had mass shootings, climate change, immigration, sexual harassment and assault, opioid and heroin epidemic, and suicide rates. So we have this baseline of high stress that already existed. We already were on the verge of this mental health crisis. And then you're adding all these things on top of it, which are even bigger and even more stressful than what we were experiencing before. And it's just set us up ripe for this huge mental health crisis. So I'm going to pass the mic to Haeli and let her talk a little bit more about the clinical side of mental health.
Hey, thanks, Amelia. So yeah, let's talk a little bit about what mental health is. It's really helpful to understand what this is. Before I go into that, is there a poll question for this?
Yeah, it should be how big of a priority mental health is at companies right now. So if you can throw the poll up, there you go. Oh, no, how does your company currently support employee mental health? Perfect.
We'll go with that one. We'll save that answer because I think that one needs to come in a little bit.
So we've
later.
got EAPs or mental health services, flexible work options, other health and wellness benefits, childcare services, PTO, mental health days. Those are pretty fun. There's a lot of companies doing mental health days now, or some combination of the above. So just go ahead and weigh in on where you guys are at. And while they're doing that, we can jump back into it.
So while you guys are looking at that, let's go on and talk about what mental health is. Do you want to change the slide over? I really love the World Health Organization's definition of mental health. It's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. So when talking about mental health, we do want to think that mental health has a lot to do with our mental and emotional state, and it significantly impacts our lives in various ways. And various factors can also impact a person's mental health, such as family history of mental health problems, genetics, brain chemistry, life experiences like your upbringing, any trauma experience, or as we're talking about, as Amelia just talked about, significant stressors in our lives, such as COVID and the pandemic and all the ways it's impacted our lives. So why does mental health matter? Let's talk about that. So like I mentioned, mental health, it has a significant impact on our lives. It's generally a ripple effect as well. It affects our emotions, the way we feel and how we manage what we feel, which affects our thoughts, the way we think, what we do with those thoughts, which is our behaviors. So it will change how we react to what's inside of us, as well as what's around us. And we have found through multiple studies, and a lot of us hopefully know, that our mental health is directly correlated to our physical health. We find it shows up with diseases, and we see it in things such as cardiovascular health, the endocrine system, and generally the more stress a person has, the less physical health is good for them. And then Amelia, if you want to, yeah. So the concerning thing though in the mental health field that we actually have been reading about and talking about a lot is we're facing a national mental health crisis right now. We were already struggling with mental health, but this pandemic has thrown it to the forefront. And what this pandemic has done, we know that we are going to see serious health consequences for years to come. We're approximating about 10 years that we're going to see the impact of this pandemic on people's mental health. So it is definitely something that isn't just a problem right now. This is something that employers need to know, that this is going to be a problem for years and years to come. And, you know, when the next generation comes up into the workforce, this pandemic has also affected their mental health and how they will perform in the work field. So we definitely know it's something that we need to be concerned about in the workforce.
Okay, so thank you, Haeli. As far as why that matters to employers, obviously that matters to us individually as individual people, but as a company, why should the company really care that much about employee mental health? We'll just talk a little bit about some of the numbers around mental health from a corporate standpoint. So it is really expensive for companies. Mental health disorders have actually surpassed cancer, cardiovascular disease, diabetes, all these really expensive things that we're paying a ton in medical healthcare costs. Mental disorders have now passed that in economic costs. So it's just getting bigger, and more people are being affected by it. So the other way that it affects the companies is actually in your employees' performance. So the Harvard Medical School did this study, and they were looking at just these 4 common mental disorders that people struggle with: depression, bipolar, anxiety, and ADHD. And between these 4, in lost productivity and absenteeism combined, on average, you lose about 35 working days per disorder. So if somebody is struggling with anxiety or depression, ADHD, bipolar, then they're missing what is the equivalent of 7 work weeks of work. So it's pretty significant. And then some of the ways that this will appear in the workplace: difficulty concentrating, right? If you're feeling super anxious, it's hard for people to focus on their work and get what they need to get done. They've also found in multiple studies that we're finding more and more errors for people that are struggling with any kind of mental or emotional challenge. They're messing up and making mistakes in their work more often. Sleep disturbances is a huge one. You're going to see this when Haeli talks about specific disorders, but basically, if you're not getting good sleep, it's harder for you to perform at work, and then you make more mistakes as well. And then physical issues, chronic illnesses. When your mental health is in a bad spot, it really opens the door for all these physical illnesses to jump in as well. Stress has been, time and time again, it's very well documented that stress causes physical sickness. So you have this like 41% of people right now that are struggling with their mental health. And out of that 41% of your own population at your company, half of those people are never going to seek help. So they never raise their hand and say, hey, I'm struggling, I need access to resources, and they don't reach out. And there's a lot of reasons why. So structural barriers are a big one, right? Those affect 26% of people who don't access the help that they need. So they don't want to go to HR and say, hey, I'm struggling. What's the number for our EAP? And then call the 1-800 number, and then get a list of providers, and then call all the providers, and then still have to wait 8 to 12 weeks to get in. So that's cost, lack of availability. It's inconvenient. Lack of availability is a huge one right now. I mean, the mental health benefits going through insurance or through an EAP, the feedback we've heard from our clients is that they are looking at 8 to 12 weeks. So if you're struggling with anxiety, or you're feeling, suicidal, you don't have time to wait 8 to 12 weeks to talk to somebody. You need help right now. So that's a big one that affects over a quarter of people that don't get help. But the huge one, and the one that we also have the most control over, and can affect without spending any money, are those attitudinal barriers. So that affects about 97% of people who do not access the care that they need. So those are things like stigmas. There are a lot of fears that employees have around their employers knowing that maybe they're struggling with depression, or they're going through divorce or something like that. They don't want their employers to know. They don't want to put their jobs at risk. So confidentiality is a huge attitudinal barrier. And then a lot of it is just education. So people think, oh, it'll just get better, it'll just go away, or they don't understand how effective mental health care can be, or that it's for everyone, right? It's not just for people who are clinically diagnosed with a mental disorder. It's like, if you're just feeling overwhelmed or you're feeling burnt out, that is also for therapy. Therapy will help you. And that's what they do. And I mean, Haeli can back me up on this, right? It's not just for people who are clinically struggling. It's for any kind. Maybe you're just having a really bad day and you just need to talk to someone. So a lot of these attitudinal barriers can be fixed just by us talking about it. And that is what I think is so exciting, is like the big elephant in the room that's preventing people from getting the care they need is something that can be solved with communication and education. So how can technology, we're at a tech conference, right? How can technology help overcome some of those barriers? I'll talk a little bit about what we do and how we approach those, but we've kind of got it broken down into 4 categories. So sharing and normalizing That is being open, being vulnerable, communication coming from HR, communication coming from the C-suite, employees who are willing to share, sharing their struggles with other employees, giving people the ability to feel brave, feel comfortable and validated to come forward with what they're struggling with, right? The more we take mental health out of the shadows and make people comfortable talking about it, it does normalize it. And then people are like, oh, you're struggling with anxiety too? Cool, I'm not alone. And then it doesn't feel so scary. So that's one big piece of it. Also ease of accessibility, right? You need the tools, you need the technology that make it quick and easy for someone to get in and see somebody immediately when they need to, and remove all of those barriers that cause friction, right? Those phone calls, waiting time, having to see somebody in person, only getting 3 or 4 visits through an EAP. Like all these things are friction points that prevent people from getting the care they need. So making it super easy for them is helpful. Providing options, we're going to talk about that. Haeli's going to talk about that in more detail, but just, not everybody's mental health care looks the same. Not everybody wants to talk to a therapist. Maybe they will watch a video on mental health, and maybe they have a teen struggling with depression and they want to learn more about that, but they don't want to talk to someone. Or maybe they'll read an article, or maybe they'll talk to a chatbot, a robot, right? There's a ton of research supporting that people feel comfortable talking to a bot because they don't feel judged. The robots are objective and don't judge them. And then they gain the resources they need that way. So being able to take a multi-pronged approach to mental health is super important. And then proactive care. What are we doing as HR leaders to help our employees before they get to a mental health crisis? How are we supporting them through mindfulness or other ways that Haeli will talk about in a minute? But there are a lot of different ways that technology can actually facilitate these 4 ways of removing stigma. And so just a quick little plug for what we do. This is our platform. So as a technology provider, we do have a platform where employees can access whatever it is that they need, whether that's yoga, meditation, we've got fitness, nutrition, life coaching, counseling services, and these are all available live and pre-recorded in video format as well. So that is what we do. And I'm going to hand the mic back over to Haeli to talk about these things in more detail. So go ahead.
Yes, thanks, Amelia. I do love to, Amelia mentioned, you don't have to have like a diagnosis of a mental disorder to be struggling with your mental health. Mental health, everybody has mental health and it affects everybody. So it's really important to know these things, even if you don't have a mental disorder. So in talking about sharing and normalizing, some of the ways that we can break this stigma is right here. And I think somebody, Mark even mentioned it in the comments. We need to talk about it. We have to start talking about mental health. One of the ways we can do that too is also learning about it, which is one of the steps that we're doing here, is the more we learn about it, the more we can talk about it. I've seen multiple studies that show getting leadership involved in the conversation helps to normalize it and break down those stigmas. So we do need to get leadership involved, teach it through trainings and workshops. I know a lot of companies that do stuff with Nivati. We offer different types of workshops for companies as well, training our managers on how to have employee conversations around mental health, discussing the variety of help options, like we talked about earlier, providing different types of options and proactive care. When we talk about those things, we are normalizing it. It's really important and helpful to communicate confidentiality so that they feel safe in talking about it. A lot of people worry when they talk about it at work that it might affect them in some way, have an impact on their job. So making sure we know that we're putting it out there that you might struggle, but this is very confidential. And also a way to normalize struggling with mental health that we've seen companies do also is providing mental health days. So they're similar to sick days, but they're mental health days. But I've also seen companies be proactive, provide mental health days in a different way, where it's a self-care time. You go and you take time off and just have some self-care time for you.
Yeah. And I add in there too, that I think it's especially powerful when it when leadership does it, right? Like if you see the CEO or, the CFO or somebody saying like, hey, I'm taking mental health day to be with my family. I just did this the other day and I set my Slack status to, taking a family day or taking a mental health day. That really gives everyone else in the organization the permission to like, oh, okay, if leadership's doing it, then I should do it. Where, if you're setting that example of just like working constantly, never taking any time off, then the team sees that, right? And they see leadership acting that way and think they have to do the same. So I think the power comes when it comes from leadership. And then also some of the things we've seen our company clients do really, really well is putting together like mental health trainings, mental health workshops, even having like the C-level suite facilitate conversations in the company where they all talk about it together. And yeah, I mean, I just can't stress that enough. The companies that do really, really well at breaking down the stigma in the workplace are the ones where it's the leadership talking about it. And maybe you can't get your C-suite to get involved that way, but even HR leadership can still have a very significant impact.
Definitely. Yeah. So in learning about it, I want to talk about some of the common mental health issues for yourself and then noticing this in others as well. Some of the most common conditions that we've always seen, but we're seeing a bigger increase during the pandemic are depression, anxiety, post-traumatic stress disorder, commonly PTSD. Mental health issues can also include substance abuse, which we've seen a really big increase over the last year and a half, suicidal ideation, a lot of relationship distress, either between couples or the child and parent, as well as domestic violence. We've seen quite the increase in that as well. So in talking about these, let's talk about some of the most common ones that we always come across. So recognizing depression. Depression, there can be periods of sadness in a person's life. That is common. That happens. A depression is when it is continuous, a continuous diminished interest or pleasure in activities. You'll see appetite disturbances, sleep disturbances, which will greatly impact an employee's performance. Psychomotor agitation, so constant go, go, go. There's also a slowdown where they slow down and it's hard for them to do anything. Fatigue or loss of energy. Feelings of worthlessness, as well as diminished ability to think or concentrate. So that difficulty in focusing definitely will affect employees' work performance. And then we can see recurrent thoughts of death. They might not have suicidal ideation where they're thinking about suicide, but there's the thoughts of death in there. And then let's talk about anxiety as well. So in recognizing anxiety, we see excessive worry. It's almost constant worry every day. The restlessness, so it's hard for them to sit still, which will be hard for somebody to do work if they're having a difficult time sitting still. They're easily tired. They get really tired really easily. Again, we have difficulty concentrating here. A lot of times with anxiety, we see irritability. Generally, when people come to me with anger issues, I look at anxiety, and then I also look at depression, because depression can also be shown through irritability. A lot of muscle tension. So then they're carrying that anxiety in their bodies. And then that's where we see that affect their physical health. And again, as in depression, we have sleep disturbances. People with anxiety do not sleep well. And so it's going to impact their work. So then talking.
Sorry. I was going to say, just a reminder, we do have questions coming in on the Q&A. So if you guys have any questions specific to depression, anxiety, or any other challenges in your workplace around mental health, just don't hesitate to throw those in the Q&A. So just a reminder, keep going.
Really, yeah. And then we'll talk, and then the other one that we see that is common that actually has, what happened with the pandemic is some people that had their PTSD, that was, they were having an okay handle of it. Things during the pandemic have triggered it, and it's created this symptom to come up again. In PTSD, post-traumatic stress disorder, a lot of times we see people having reoccurrent and unwanted thoughts of the traumatic event or events. They will have nightmares and upsetting dreams of the events. So again, we're seeing sleep disturbances. Emotional distress, when we have something that reminds us of the traumatic event, or a physical reaction, reacting out. That's the behaviors we talked about. When people have mental health distress, they find that we see it come out in their behaviors. And then this is where it also can impact people's negative thoughts about themselves. A lot of times trauma victims view themselves at fault and look at themselves negatively. Hopelessness about the future. A lot of the times we have difficulty with relationships and they detach themselves from family and friends. So they are isolating themselves, and then that's going to lead to the depression where it's isolation, and we see common symptoms come in there. So these are some of the more common mental health disorders: depression, anxiety, and PTSD that we see. There's a wide range. It can affect everyone differently, but I always love talking about these so that people kind of get in a general idea to see what kind of symptoms are happening for people struggling with their mental health.
Haeli, can you also talk a little bit about kids and family members? I know we have another presentation we do specific to parenting, but just like, how do employers like in HR help those employees that maybe have family members that are struggling, and a little bit just about, how many kids right now are being affected negatively as well?
Yeah, this is one of the largest populations we've seen an impact on mental health is in teenage years, adolescent years especially, but we are seeing an increase. I work with teens a lot, and we have quite the wait list because it has impacted their mental health so much. And when that happens, if any of you are parents, I don't know, but it's going to impact the parents' mental health as well as the parents' ability to perform at work. When a parent is at work worrying about their child, or they have to miss days because of their child. So we always encourage offering, some of those mental health days for people to use. It's a family time because they need to be taking care of their children. It does affect their work ability. We've seen a really big increase in that.
Awesome. Thank you.
Mm-hmm. Okay.
Still you.
No, I'm like, okay, this is still me. So how do we help an employee? Okay, we see they're struggling. We know somebody's struggling with their mental health. We're seeing it impact their work. How can we help? So these are kind of the ones that we start with. One, you've already been doing, understanding signs and symptoms. It's easier when we know about mental health, kind of what's going on there, work productivity is less, they're making more errors, they're missing more work. So understanding those signs and symptoms, creating that safe and confidential space where people can talk about it, knowing that it's not going to impact their position at work. Encouraging them to share their feelings. We're going to talk about that, as well as using good listening skills and learning what to say and what not to say. Those three things we're going to talk about in just a minute. Those are very helpful ways to be supportive of somebody. Taking care of your own mental health is extremely important. We cannot help others if we are not in a good place ourselves. And providing employee education. So talking about it, providing resources so that they can learn about it themselves as well.
Yeah. And just jumping in on number 6, I cannot tell you guys how many times I'm on a call with some HR leader and they're like, yeah, they're acting as a therapist for their employees. Like they have employees coming to them. This is so common right now. I don't know how often this happens to you guys, but they're like, oh yeah, people are coming to me and they're telling me about their personal struggle with anxiety or depression or whatever. And they're not able to get into a mental health provider through insurance or through their EAP. So they're going to HR, and there's so many HR leaders right now acting like therapists that don't have the background or the training and are feeling super overwhelmed with that. So, especially when, and Haeli can talk more about this as a counselor, right? She's helping people with their mental health all the time. But especially when you're in a position that you're helping your employees who may be struggling, it's so, so, so important that you're taking care of your own mental health, because otherwise we just end up absorbing all that and taking other people's stuff on, and it'll just weigh us down and hurt our own mental health. So Haeli, what do you do for your own self-care so that you can provide mental health support for people?
Yeah, no, that's a great question, because we do, I run HR anxiety groups frequently for people in HR to help them with their own mental health. And we talk about this a lot. And I always explain, as a counselor, I have to do these types of things well, because I never realized in HR how many people come to you with their problems until I started running these groups. And some of the important things we talk about are putting in healthy boundaries with your job and making sure you have time for your own self-care, putting those limits in place, and then practicing taking care of yourself, making sure you're seeing your own therapist if needed, and that you are doing these things that we talk about to take care of your own mental health is really important. Okay, so let's get talking about how to communicate. These are some things I love to put in there so people realize what to say, what not to say. I'll go over them real quick. Things we can say: I'm here if you want to talk. Just knowing they have someone that would listen to them is so, so, so helpful. What can I do to help? What can I do to support you? How can I help you with this? Is extremely helpful. How are you coping? So asking kind of what skills they're putting in place. I wanted to check in with you. I've noticed you've been distant, or that you've been, kind of down lately. Asking what is concerning you today. How has work been stressful for you lately? And what do you do to take care of yourself? What not to say. These are things that can be detrimental for people to hear sometimes, is why don't you just snap out of it? Just stop thinking those thoughts and move on. Lots of people have it worse than you. It's all in your head. Hey, let's just look at the bright side, that one is because then it diminishes what they're feeling and thinking in that moment. Why are you being so negative? I think you're just being too sensitive. And why do you let yourself feel these things? Why do you let yourself get this way? Why do you let yourself think these thoughts? So really trying not to diminish their things and instead be there for support and listening.
Just a quick thing in the chat. Somebody was asking about our HR support group. So Haeli and I do run an HR support group. It's HR leaders from all over the US. We run them in groups of 10 to 15 HR leaders, sometimes smaller. It just depends on the time of year, but it's a 4-week cohort. Haeli runs it. You'll meet with other HR leaders, and she'll teach you how to manage stress and anxiety and handle some of those conversations with your employees around some of the stuff that we're talking about. So anyway, I just threw that in the chat. So if anybody wants that, the link is in there. You just submit the form and we'll get you signed up for one of the next sessions that we have coming up. We usually run about 2 a month, and they last for 4 weeks. So sorry to jump in there. I just wanted to let everybody know.
Okay. And yeah, why don't we put in the poll 3. Have you ever talked about mental health with a team member? I'm really curious to see what the results come back with this. And then I just saw the chat, and Paul mentioned the lots of people have it worse than you. And that is, every situation, someone's going to have it worse and someone's going to have it better, but we in no means want to ever diminish what a person is feeling in that moment. Because to them, that's hard. And so it is very important that we be careful with that one. Okay. Did the poll results come back? I don't see them.
Yeah, it looks like 15 out of 18 are saying yes. Nope, 17 out of 21. It keeps going up, but it looks like about 3/4 have had conversations about mental health with their team, and about 1/4 of them have not. So
okay,
good information, tiny.
Yeah. So on to the next slide. Let's talk about mental health best practices. Educate yourself. Follow mental health resources. We have a few up here that we like, and encourage your employees to follow these kind of places too. Set the example. Show your employees, like Amelia mentioned, show your employees that you prioritize your own mental health, having clear work-life boundaries. not responding to emails on the weekends or out of office hours, and talking about mental health. Establishing a meditation time for your team. If you're working in person, meditate together, or if it's a virtual, challenge them to work on their own time. You could even have, a group, hey, we're going to do a quick meditation all together at this time. Ask employees how they're doing. This is that communication, ask them, having one-on-one sessions where we have direct reports every week to talk about their work. How are you coping? How are you handling the stress? Are you feeling a lot of stress? Just putting those questions out there, because a lot of people will be very scared to bring it up themselves. Make it clear that you're wanting to help them succeed at their job.
And I do use that one-on-one time with my employees. We're really big on one-on-ones here, just making sure, even if it's like 15 minutes, but that each employee has a touch point with their manager. And like the goal of those one-on-one times is a lot of it to get a feel on how your employees are doing, if they're struggling with anything, and how you can help. So, I try to make sure I know them, I know what's going on in their families, and that they feel, heard and understood. And then people feel connected to the manager, they feel connected to the organization, and they give better work. So I think those one-on-one sessions are key to really getting to know that employee personally. And that's where you're going to see some of those signs and symptoms. In fact, I had a call with one of my employees, and because we had been having conversations like this for so long, she felt comfortable coming to me and saying like, hey, can I get access to our own mental health services? Because I need help going through, some of the things I'm going through. And if I wasn't meeting with them and having those types of conversations on a regular basis, then she may have never felt comfortable to ask me for those resources. So it's just a really good way to stay connected to them and see how they're doing.
Yeah.
So I want to hit some of these Q&A questions just to make sure we have time for them, and then we'll go through the remaining slides. But do you want to start with Alyssa's question, Haeli? Alyssa says, do you see trends in particular generational groups, so specific generations, being more comfortable talking about mental health? My observation is that employees that are newer to the workforce are more quick to break down the stigma, as opposed to employees with more years in the workforce. A big generalization, but curious.
Yeah, no, that is correct. We do see that the younger generations are a lot more open to talking about mental health, and it's becoming more popular for them to implement, like, hey, I go to therapy. Therapy's cool now for the younger generations, where it's a little bit more not talked about in the older generation. So we definitely do see that generational trend.
Awesome. This is a question from Mark. What are some of the best strategies for checking in with someone you suspect is having a hard time? So yeah, if you don't already have that rapport with them where they feel comfortable talking, like how do you approach that in the first place, Haeli?
Well, I think where Amelia mentioned the one-on-ones, having some one-on-one time, just kind of checking in with them and talking to them, stopping by where they're working and just seeing where things are for them, building kind of a relationship, a healthy, friendly working relationship where you can start talking to them about things, and then it just slowly opens it up. And maybe you start at the top surface level stuff, and then you slowly start asking questions that go a little bit deeper and deeper.
Awesome. Vish asked a couple questions. Could the platform from Nivati work seamlessly with existing HR systems? So the answer to that is some HR systems. So we are just finishing our integration with Bamboo HR right now. We'll actually be the first mental health or wellness platform that integrates with Bamboo HR in their marketplace. So super excited about that. After that, we're going to be knocking out some of the integrations with different HRIS systems. So right now we have SSO, so we can do single sign-on through Okta. The Google SSO is almost done. But yeah, our goal is to eventually have like all the HR systems set up. So it just depends on which one you guys use. But we do want it to be super seamless, especially large organizations, right? If you're managing 5,000 employees, you don't want to have to be like, oh, these people no longer work here, but they self-provision in our system. Will connect them to your company based on their email domain. So that's how our system knows who people belong to. So they can actually go and sign up themselves, and the system will automatically assign them to your group. It's just offboarding them that is manual if you're not on one of the platforms where we already integrate. So soon we should integrate with many HR systems, but right now it's just a handful. So hopefully that answers your question. And then, is there a way we can track the progress of employees using the services? Yes, actually. So we have a demo today at 2:30. If you guys want to jump into that, I don't think we'll have time to like demo it for you right now, but there is a dashboard. You can see, we actually do a well-being assessment the first time an employee logs in and creates an account. And then that assessment is triggered every 90 days. So you guys can track your employee well-being scores over time by quarter. So you can track the progress of the employees. You can also see what videos are being used, what category of video, like are they using 50% of it is meditation and then mental health services and yoga, or you can see exactly what your employees are consuming. You can see how many sessions of mental health or any other live service, if you have coaching available as well, you can see exactly what's being used every single month. So hopefully that answers your question. If it doesn't, shoot another question up there, but those are the questions we have. If you guys have any other questions, pop them into the Q&A and we will get to those. And then I'm going to keep going. So we have a handful of other strategies we wanted to share with you guys before we end, just on eliminating some of those barriers. So ease of accessibility, we talked a little bit about, but there are a lot of solutions out there, not just us, obviously. There's a lot of different mobile apps and digital solutions. Email therapy and chat therapy are very popular, especially with the younger generations. I know, like, my teenagers would rather just text than ever have to speak to a human. So I think we're seeing, and I have a sister who's 25 too. So same kind of thing for those generations that grew up with mobile phones, feel a lot more comfortable using those. Like I said, chatbot as well is another one. So just kind of making sure that you have whatever solution you have, there are multiple prongs of care, whether that's chatbot, chat therapy, video therapy, videos they can watch. There's just a lot of really cool tools out there. And then company paid therapy options outside of insurance. So one of the things we're finding is that insurance is so clunky for people to use. 9 times out of 10, they haven't met their deductible, so they still have to pay for it out of pocket, unless they have like a really nice HSA, which some companies do and some companies don't. But that can be a big barrier for people, make it harder for them to use. They still have to go call offices. I had to find a very specific behavioral therapist for my 9-year-old recently, and I had to call like 10 different offices, leave messages, wait for them to call me back. Multiple offices were like, we don't have any availability, we're not taking new clients. And then finally I found somebody, and it was like 6 weeks from now. So my daughter has a specific type of ADHD, so she has to go to someone. Otherwise, I would just treat her through my own company. But and the younger kids also have a harder time with virtual. They like the face-to-face therapy a lot better when they're little. So anyway, working through insurance is a pain for a lot of companies. Even if you have like really great benefits, it can still be a barrier for people. Giving them direct access. One of the things that's cool about our platform and other companies that do, mental health virtually, is that you can just go in there and you can read the bios, you can pick the person you want to work with, and you have a lot more ownership over your care. So you can go in and say, and we can show you guys this in the demo too, if you hop into that. I could look at Haeli's bio and I could be like, oh, she specializes in teenagers, she specializes in depression, or, whatever. And I can pick the person that has the background that I want. And then hard limits on the number of sessions. That is a really painful experience for people. If they get through their first 3, 5, 6 sessions, whatever your EAP provides, and they have built that rapport with their therapist, somebody like Haeli, and they're finally getting to the point where they're like, okay, I can open up and I can really get the help that I need. And then that therapist is like, and we hit our limit. It's either going to do one of two things. They're just going to stop having care, or they have to start all over with a brand new therapist in your network, or they're going to lie and make up a new reason to go use the EAP again. So you're kind of like encouraging, those programs kind of encourage people to be dishonest, which is hard. So anyway, and then some of the things we talked about, I'm not going to belabor the point, but just making sure you have multiple types of ways of helping people with their mental health. One of the things I didn't mention was coaching. So what we've also seen is that some people who aren't open to therapy will talk to a life coach and get some of like that positive direction and positive reinforcement. Yeah, they don't have the same training and background as a therapist, but it's a good way for them to kind of like get started talking to someone. And then that life coach can say, hey, you should go see a therapist, and kind of recommend them up. So we have found that as a good like entryway for people who are a little more resistant to therapy. And then being able to access a phone or text crisis line. So 24 hours a day, you're struggling at 2 a.m., making sure you still have access to someone. And then Haeli, do you want to talk about this one?
Yes, sorry. My phone was ringing on my computer and I couldn't find the button to stop it. Okay, so here's one thing that we do notice too, is some people are not comfortable with just going from here, point A, to therapy. They feel very uncomfortable with it. They've never looked at or sought help before. And so we do notice some people like take smaller steps to get to therapy sometimes, and that's okay. Some of these first steps, breathing, meditation, yoga, are great ways for people to start out in helping with their mental health. And then, as Amelia said, there's the coaching option, because some people don't feel comfortable with therapy. So sometimes we can get them into coaching. And then, once they get into coaching, there's times where people are like, hey, I think you should see a mental health therapist. And so by now they're generally a little bit more comfortable with maybe getting into therapy. So we do like to see that in small steps at times. The first 3 are things that we like to start out with sometimes too, because it is mindfulness, and mindfulness can be so great and so wonderful. We use it a lot in therapy, and people don't even realize how much we use it. So I love to teach people a little bit about mindfulness. Mindfulness is calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, used as a therapeutic technique. So it is definitely something that we talk about in therapy, and it's used in evidence-based practices. So they've been scientifically researched and tested. We use it for depression, anxiety, PTSD, ADHD. We use it in a lot of different types. Ways to practice mindfulness: using your 5 senses, touch, sight, taste, smell. Those are great ways to start out. And then if you remember those small steps, using your breath, just noticing your breath can help you practice a moment of mindfulness, as well as meditation. Some great mindfulness practices.
Okay, looks like we're out of time. So yeah, if you want the slides, happy to share the slides with you. You can shoot me an email, throw my email in the chat. So you can shoot me an email. You can visit our booth. We also have our mental fitness toolkit that you can download for free at our booth if you want. There's a ton of resources and things you can use with your teams in that toolkit. So yeah, go check us out, and you can there's a few more slides, but that is us. There's my email. There's Haeli's email. Feel free to reach out to us directly or visit our booth. And we have a demo at 2:30 Mountain Time, which is 4:30 Eastern, I think. So anyway, check us out at the demo. Thanks, guys.
This concludes our webcast today. I'd like to thank our presenters as well as all of you for joining us. If you've joined late and would like to view this webcast again, the recording and slides will be available on hr.com in our archive virtual events. Your HRCI credit will show up in your hr.com account within 2 business days. We will also send out an email with the credit information. Please take a few moments to fill out the webcast survey that will open on your screen. Your feedback is important to us, and thank you all, and enjoy the rest of the event.